Good afternoon and welcome to the Women Veteran Teletown Hall. We will begin shortly. It does take a few minutes for our veterans to be called and connected. So until then, we want to provide you with some updates as we wait for everyone to join the call. The first update we have is the crisis line is now available nationwide by dialing 988. And for veterans, all you have to do is press 1 to get connected to crisis services. While the prior crisis line phone number is still active, we are encouraging all to use the simple to remember 988 number to access crisis services. Please put it in your phone today. The Madison VA is offering the new bivalent COVID-19 vaccine booster appointment. If you have not already done so, make your vaccine or booster appointment today by calling 608-280-2160. That number again is 608-280-2160. Good afternoon and welcome to the Women Veteran Teletown Hall. We will begin shortly. It does take a few minutes for our veterans to be called and connected, so until then we want to provide you with a couple more updates. Get the most current updates from the Madison VA by signing up for email updates. All you have to do is go to www.va.gov/Madison-Health-Care. Scroll to the bottom of the page and subscribe to VA Madison Healthcare News and Announcements. You will get our quarterly newsletter, press releases, and other communication products as we release them. Again, if you'd like to sign up for the newsletter and press releases and other communication from the Madison VA, go to www.va.gov/Madison-Health-Care. We also encourage veterans to like our Facebook page, where we routinely provide national and local updates about what is happening at the Madison VA, including events like this Teletown Hall. Good afternoon and welcome to the Madison VA's live telephone town hall. Our leadership team is excited to hold this Teletown Hall with women veterans who use the Madison VA or any of our 6 community-based outpatient clinics in Baraboo, Beaver Dam, Janesville, and Madison, Wisconsin, as well as Freeport and Rockford, Illinois. I encourage you to stay on the line with us and participate. This gives you an opportunity to speak live with us and ask questions about your VA healthcare. My name is Tammy Town. I am the Facility Women Veterans Program Manager, and I will be moderating this afternoon's call. Thank you for taking the time to join us. A panel of Madison VA's leadership team is here to answer your questions. This includes our Hospital Director, John Rohr, Acting Chief of Staff, Dr. Ryan Marsh, Acting Associate Director, Abra Rabinowitz, Associate Director of Patient Care Services, Teresa Edgren, Health Benefits Lead, Pamela Greason, Mental Health Specialist, Sarah Frazier, Community Care MSA Supervisor, Tara Eastlick, Clinical Pharmacy Specialist, Rachel Mays, Suicide Prevention Program Supervisor, Andrea Bailey, Mental Health Specialist and Trauma-Informed Care Advocate, Sarah Birdsall, Whole Health Program Manager, Sarah Rogers, Women's Peer Support Specialist, Ann Bullifield, LGBTQ+ Veterans Care Coordinator, Margot Edge, and Patient Advocate, Cheryl Scott. We hope this Teletown Hall provides a more convenient way for you to speak with Madison VA leaders and get answers to your questions. We want to reach more women veterans so we can ensure we hear your voice and focus on what's important to you. Please note, for the next hour, this is a live question and answer session. If you would like to ask a question, just press 0 on your phone, and you will be connected with a staff person who will take your question and get you in the queue to speak with our panel. We'd like to address as many of your questions as possible during this call, so we have to limit participants to 1 question each. If you do get on air, please remember that other veterans are in line to ask questions. So keep your questions brief, and please do not share your personal health information in the public forum. If we are not able to answer your question on air, we will make sure to follow up with an answer to your specific question. We want to make sure all questions received are answered. If we don't make it to your question by the end of the call, be sure to stay on the line and you'll have the opportunity to leave us a voicemail so someone can get back to you. I'm going to turn the call over to Hospital Director John Rohr for opening comments, but you may begin asking your questions by pressing 0 now. Remember, all you have to do is press 0 to speak to one of our operators.
Thank you, Tammy. We're thrilled that you are joining us this afternoon to participate in our Teletown Hall. This format allows you to ask questions and us to provide you with important updates. So today we're focusing specifically on our women veterans. At VA, we are here for you. Women veterans belong at our VA. In fact, every VA has a Women's Veteran Program Manager on staff to advocate for you and to help you navigate the VA. Once enrolled, you will get support from VA staff specifically trained in caring for women veterans. In addition to our Women Veterans Program Manager, we offer women's health primary care providers who are trained in general primary care as well as gender-specific care, such as breast health and reproductive care. You can ask to be assigned one as your primary care provider at the VA. Or patient-aligned care teams. This is a team of medical professionals who can help coordinate VA services and offerings to align with your personal health plans and goals. At each CBOC, there is at least one women's health designated PAC in which the providers and care team have training in women's health care. Our women's mental health champions are mental health professionals who have received special training in women's health, in women's veterans' mental health. And our maternity care coordinators are responsible for assisting pregnant and postpartum veterans in navigating healthcare services both inside and outside the VA. MCCs can help you make appointments, manage claims, and more. And our LGBTQ plus veteran care coordinators are trained in LGBTQ plus veteran health, who can help LGBTQ plus veterans coordinate their care. Our goal today is to hear from you, our women veterans, so we can continue on the pathway to providing excellent care services for you. So I look forward to your questions today, and thank you so much for your participation.
Thank you, Director. While questions are coming in, let's begin with an update about the PACT Act from Pamela Greason, our Patient Administrative Service Lead.
Thank you. The PACT Act is a new law officially titled the Sergeant First Class Heath Robinson, honoring our promise to address comprehensive toxins that are known as the PACT Act. And it represents perhaps the largest expansion of health care and benefits in VA's history. The PACT Act expands and extends eligibility for VA health care for veterans with toxic exposures and veterans of the Vietnam, Gulf War, and post-9/11 eras. It adds more than 20 presumptive conditions for burn pit, Agent Orange, and other toxic exposures. Requires the VA to provide toxic exposure screenings to every veteran enrolled in VA health care. It helps the VA improve research, staff education, and treatment related to toxic exposures. It expands benefits available for illness resulting from toxin exposure. When veterans serve our country, many were exposed to toxic hazards. For too long, veterans and their survivors were not able to access toxic-related benefits and services, including many Vietnam-era, Gulf War era, and post-9/11 veterans. The PACT Act expands that and expands our ability to provide services to address these conditions. We know there are millions of veterans and survivors across America who are eligible for new health care and benefits as a result of the PACT, and we are making every effort to ensure broad understanding of what the PACT includes and offers so that everyone who is covered understands how they can access the benefits and services they have earned from their service. Today we want to ensure that all of you take action to explore this eligibility. Here are 5 things that we want to make sure all veterans know about this new law. We are encouraging veterans to apply for PACT Act benefits and care right now. Veterans Benefits Administration, or VBA, began processing veteran claims for PACT Act compensation on January 1st. We encourage you to work with your county vet service officer or through your Veterans Benefits Administration to submit your claim as soon as possible. For some veterans, worry that applying for benefits under the PACT Act may negatively impact existing benefits. The truth is, there is a 97% chance that your benefits will either increase or stay the same when submitting your application. There are people out there working to convince veterans to use a lawyer to apply for VA benefits. This is simply not needed and could result in diversion of benefits. you have earned to pay for unnecessary legal fees. Applying for PACT Act benefits is free, and you can do it working directly with your county vet service officer, vet service organization, or through the VBA. While we may not be able to provide you specific answers today regarding your eligibility, we do suggest you contact your county vet service officer, vet service organization, or the Veterans Benefit Administration for screening. Every person and every situation is going to be different, and they will be able to best direct you. You can learn more about PACT Act and apply by visiting www.va.gov/PACT or by calling 1-800-MY-MY-VA-411 or 1-800-698-2411. Again, that's www.va.gov/PACT or by calling 1-800-MY-VA-411, which is 800-698-2411. Thanks again for your attention today and for joining us on this call. Please don't wait. Explore your eligibility for PACT Act benefits today. And importantly, tell fellow veterans who may not be connected today with this VA opportunity.
Thank you, Pamela. The PACT Act update fits perfectly with one of Women's Health's campaigns this month of sharing your deployment story. Sharing your deployment story can be helpful to your provider. You can include as much as you feel comfortable sharing. You can share details that may seem minor to you, like medications you're prescribed and how long you took them or procedures you underwent while being deployed. There are a variety of health concerns that may be related to certain deployments and roles. The best way to determine if your health care is a result of your deployment is to share your deployment story with your provider. I also want to take this time to bring everyone's attention to heart disease. Heart disease is the #1 killer of women in the United States. Knowing this, it is important for our women veterans to know their numbers, understand what heart health means, and know how to have a healthy lifestyle. At the Madison VA, we have our annual Go Red event on February 3rd from 9 a.m. to 1 p.m. at the main hospital. Stop by the event to learn how to eat smart, stress less, and move more, all in a heart-healthy way. Have a conversation with our different departments and learn more about the programs that we offer at the Madison VA hospitals and clinics and how they relate to heart-healthy living. We will have food demonstrations and tables set up with information about various heart-healthy topics. Again, that's February 3rd from 9 a.m. to 1 p.m. As we are collecting questions, we want to take this opportunity to learn more from you. We have a couple of voting questions for you. The first question is, were you aware that each VA site has a maternity care coordinator? To respond yes, press 1. To respond no, press 2. Again, that question is, were you aware that each VA site has a maternity care coordinator? For 1, press yes. For no, press 2. For yes, press 1. For no, press 2. It looks like we have about 81% that said no and 20% said yes. So many of you are not aware that we have a maternity care coordinator, and we do have one here at our Madison VA. Her name is Lindsay Mueller, and she's our maternity care coordinator. All right, we have one other polling question for you. Do you receive email updates from us, including our quarterly newsletter? For yes, press 1. For no, press 2. Again, that question is, do you receive email updates from us, including our quarterly newsletter? For yes, press 1. For no, press 2. So it looks like 63% of you said no, and about 36% of you said yes. So if you'd like to sign up for the newsletter, we do have, you can go to that website, www.va.gov/Madison-health-care. And if you scroll to the bottom of that page, you can subscribe to the Madison VA Healthcare News, and that's where you can receive the newsletter and many of the press releases from the Madison VA Hospital. So we have a few more updates. Sarah, one of our women's health social workers from our Rockford CBOC, will provide an update on trauma-informed care.
Good evening. The Madison VA has taken the initiative to develop a trauma-informed care worker to increase the experiences of veterans at our VA facilities. Trauma-informed care makes the assumption that a person has more likely than not experienced trauma in the past. Trauma-informed care acknowledges the existence of trauma symptoms and the potential impact that trauma may have on an individual's life, including that of our military veterans. Our goal as a facility is to actively avoid re-traumatization of veterans within our care. The Trauma-Informed Care Work Group was created to bring together team members to address care practices to all veterans, as well as increase our standard of care. We realize that the wide impact of trauma and understand paths for recovery. Therefore, we are striving to recognize the signs and symptoms of trauma in patients, families, and staff. To provide trauma-informed care, we are seeking to integrate knowledge about trauma into policies, procedures, and practices across our VA Medical Center. In addition, the providers at your VA are empowering women veterans to work collaboratively with all of their providers to ensure safety and prevent re-traumatization. We proactively recognize the power differences between staff and clients to provide support for decision-making. Throughout the hospital, we work to ensure that staff and patients feel psychologically and physically safe.
Thank you, Sarah. Next, we have Andrea, our Suicide Prevention Program Supervisor, with a suicide prevention update.
Thank you. The Suicide Prevention Team wishes all veterans a Happy New Year. We also know that sometimes the winter months can impact mood. We want to be sure you know that veterans and their loved ones can now reach the Veterans Crisis Line by dialing 988 and pressing 1 to reach caring, qualified responders 24/7. Veterans are still able to call the 800 number that you might see listed on other materials as well, so 988 is much easier to remember. Veterans and their loved ones can continue to reach the Veterans Crisis Line chat feature at veteranscrisisline.net and can continue to text to 838-255 to reach responders. Again, for chat, you can reach the chat responders at veteranscrisisline.net, or you can text to the number 838-255 to reach responders.
Thank you, Andrea. We have a few more questions of discussion coming up about the East Clinic remodel, women veteran peer support services, and women's mental health programs. But let's pause to take a few questions. So up we have Brianna Benson. Brianna, what question do you have for us?
Hi, my question is, I've heard various kind of rumors about this. I'm transgender. I'm transitioning to male. The VA is currently covering my HRT, but I was told that as of right now, you were not covering transition-related surgeries, but that might be changing in the near future. I'm wondering what the probability that will change and on what type of timetable that, if it's going to change, that it would.
Hello, that's a really good question. So President Biden had committed to exploring this option and expanding benefits. At this time, that hasn't been included as part of the benefits package, but it's still being explored on a national level. And our facility is continuing to progress in training and addressing LGBTQ veterans issues. So hopefully we will have an update soon, but nothing is confirmed at this point to include surgery. But all LGBTQ veteran services are included in the benefits package except for surgical interventions.
All right, our next speaker that we have up is Catherine Pinko from Oconomowoc. Catherine, what's your question for us?
Hi. I think you may have already answered my question. I was curious about the mental health phone number that you just talked about, and could you tell me what information is provided from that phone number?
Sure. The Veterans Crisis Line is a 24/7 confidential crisis support for veterans and loved ones. And the phone number for that is 988. It's 988, and you can text or call that number.
And I can add a little bit about that. If you've never called the Veterans Crisis Line before, they will ask for your information, phone number, your name. They probably will ask for the last four of your Social Security. And then they'll talk to you about what sorts of issues you're facing and can provide you with resources both within the VA system, including connection to benefits association or connection to homeless services. And they also will offer you a consult to the the suicide prevention coordinator for follow-up care as well.
Our next caller is Sharon Ganwa. Sharon, what question do you have for us today?
Yes, mine has to do with the PACT Act. My primary, she asked me two questions when I was in a couple weeks ago. One was I exposed to anything? And two, what was it? And one, I tried to give her a list of the items that were at Fort McClellan, because Fort McClellan was basically the most toxic base in the United States by the EPA. And also, it was 100% women in earlier years when I was there. And I gave her a listing from the stuff that I knew that was on the base that was used while I was there, because I've got copies of the forms from the EPA. Anyway, she just said, okay, she threw them away, didn't write them down, and she said, we'll ask you again in 5 years. Well, what good is the PACT Act if I'm sick now and they'll talk to me about it again in 5 years? I don't understand.
Sure, absolutely. This is Dr. Marson. I'm really sorry that happened and that you had that experience. We are aggressively training all of our providers about the PACT Act, and it's really about connecting people to resources that might be able to answer your questions. And so there's also the opportunity to go to one of the registry exams that you can get more information from. And so there are resources that are available, and I'm sorry that happened there, and we can certainly put you in touch with those people.
Yeah, because if there's a registry exam or something, then I think that should have been provided, because I would have, signed up for one immediately.
Sure, absolutely.
Thank you. Next up, we have Luann. Luann, are you on the line? What question do you have for us?
Hi, my question is concerning the PACT Act as well. I was stationed in the Gulf War for Desert Storm, Desert Shield, and when I retired in 2005, I was not rated for a disability. However, through what I've read about the PACT Act, I possibly could. So I was wondering, is that a possibility to change my disability rating?
Yes, that's a very good question, and something that we gave a little bit of more information out previously. So the benefits for compensation would be going through your local county vet service officer or your vet service organization, and it has expanded where the chance of your service connection increasing or remaining the same is prevalent. It's definitely worth going to file a claim and get more additional information through them.
Or county VA?
The county vet service officer, what county are you in?
I'm in Grant County.
Grant County? Okay. So you can literally Google this information, but I do have a URL you can go to for more information and a list of your county vet service officers. You can Okay, go ahead.
I have his name and number. I was just wondering if it's a possibility that my rating could get changed, or do I just need to fill out the form first and then I would get a phone call to find out, or do I need to provide information to get it changed?
Yeah, your local vet service officer can talk you through that entire process, and it is definitely a possibility that it can get increased, yes.
But you do have to take action.
All right. Next up, we have Adriana Marks. Adriana, are you there? Adriana, are you on the line?
Yes, I am. I was wondering in the new clinic on the east side if they're going to have a women's clinic, and will we have the same care as what is at the main hospital, or will we have to go to the main hospital?
I can answer that. For the planning for the new East Clinic, there will be a Women's Health PACT team there. So I will get into a little bit more of a description of the other services that will be available at the East Clinic, but there will be a Women's Health PACT team available at that site.
Thank you.
And that's a good segue. So we'll queue up a few more questions, and I'll pause briefly to update you on what's been happening at the Madison VA. So first we have our Acting Associate Director, Abe Rabinowitz, on our new East Clinic and West Clinic remodel.
Okay, well, thank you, Tammy. And as many of you now know, if you didn't know before, we are building a new outpatient clinic on the northeast side of Madison. The clinic will be located by Interstate 9094 and Highway 151. Some of you may have seen pictures on the news of our Facebook or on our Facebook page of the groundbreaking ceremony that we held there on June 1st. Right now, the contractors are out there working, and they're making good progress constructing the building's foundation. We do anticipate the construction to be completed in late spring of 2024, with the grand opening taking place in early summer of 2024. So the new East Clinic will be over 29,000 square feet and will offer primary care, physical therapy, mental health, telehealth, blood draw, radiology, x-ray, and whole health services. And as I just mentioned, there will be a Women's Health PACT team located there. We hope the location and expansion of this clinic will offer you greater access to care. We do know it will offer significantly greater access to care to many veterans based on the demographic studies that we did in planning for the clinic. Following the East Clinic's opening, the West Clinic will also be remodeled, and remaining services will include 5 PACs, including a Women's Health PAC that will stay at West. West Clinic will expand to include more whole health offerings and will continue to offer blood draw, telederm, and integrated mental health. Thanks very much, Tim.
Thank you, Abe. We have another question for all of you to take. We would like to receive feedback from you on the East Clinic. So the question is, an East Madison VA clinic is anticipated to open in 2024. Would this be a site that you would prefer to be seen at for primary care? For yes, I plan to go to the East Clinic when it opens, press 1. For no, I plan to stay at the current VA clinic I go to now, press 2. For no, I plan to receive primary care outside the VA, press 3. If you are undecided, press 4. Again, the question is, an East Madison VA clinic is anticipated to open in 2024. Would this be a site that you would prefer to be seen at for primary care? For yes, I plan to go to the East Clinic when it opens, press 1. For no, I plan to stay at the current VA clinic I go to now, press 2. For no, I plan to receive primary care outside the VA, press 3. If you're undecided, press 4. All right. Looks like most people are planning to go to the current clinic they go to now, about 68%. We have about 26% that are planning on going to the East Clinic. Excellent. All right. So now, next up, we have Ann Bolifield, our Women's Health Peer Support Specialist, to provide you an update on our peer support services.
Thank you, Tammy. Did you know Madison VA has peer support services for women veterans? Peer support offers one-on-one services, social groups in the community for women veterans in Freeport, Illinois, and Baraboo, Wisconsin. We offer a weekly phone group called Strength and Recovery for women veterans. Peer support, along with VA Farms and Gardens, is also offering Women's Tea Garden Group, which focuses on improving one's surroundings through indoor gardening and community building. If these interest you, please reach out to your primary care or mental health providers to be put in touch with the Women's Health Peer Support.
Thank you, Ann. Next, we have Sarah Frazier, one of our Women's Health social workers, who has an update on mental health services.
Hello. The Madison VA is pleased to continue offering mental health services specific for women veterans. We have 3 clinicians across our Central and Rockford community-based outpatient clinic locations offering a special type of therapy for women veterans called interpersonal psychotherapy for reproductive mental health. Interpersonal psychotherapy for reproductive mental health helps women develop skills to improve relationships, handle life transitions, grieve losses, and reduce distress. Our Women's Courage group, focusing on sexual trauma recovery, will begin again via VA Video Connect later this month. In Rockford, we offer a Women's Living Skillfully group. This group focuses on building dialectical behavioral therapy, or DBT, skills to improve quality of life and relationships. To find out more details about accessing these services and the times, dates, and locations of these groups, please call the Mental Health Department at 608-280-7084. Again, that's 608-280-7084. And if you haven't already, please also subscribe to the Women Veterans newsletter. Keep up to date on our newest information and programming.
Thank you, Sarah. Let's take some more questions. So up next we have Stacy Horstmeyer. Stacy, are you there? Hi, Stacy. Are you on the line with us?
Yes, I am.
What question do you have for us today?
I was just wondering about some long-term effects with COVID, with brain fog. I priorly have anxiety and depression issues, and I've just been having terrible memory loss, like short-term and scatterbrained. And any recommendations I could do?
Sure. Yeah, this is Dr. Marsh. So certainly talking to your primary care provider will be important here to start that discussion of whether referrals are appropriate to some of our specialty clinics to investigate that further.
Okay, thank you.
Next up we have Nancy from Arizona. Nancy, are you there?
Yep, I'm here. My question is, I was at Camp Lejeune for that toxic water in 1983. My daughter was born there, and does the PAC cover that or not?
Thank you for your question. So the contaminated drinking waters in Camp Lejeune has been recognized for quite a while now, and there is an extensive list of conditions associated with that exposure. If you have any of those symptoms, not only does that exposure make you eligible for VA health care in itself without having to provide financials for that eligibility, but it also extends benefits to family members that may have also suffered from those conditions. It's not providing health care for them through the VA, but it is extending monetary compensation for them through the VBA. So if you're looking for monetary compensation, again, your best resource is to reach out to the Veterans Service Organization or County Vet Service Office. And if you're looking to see if any of those conditions apply to you for health care, you can always call the eligibility office and we can provide you with a list of those symptoms, or they're readily available online.
All right, thank you. Next up with another PACT Act question is Jensen. Jensen from Madison, are you there?
Yep, I'm here. So about the PACT Act, you mentioned before to contact our county veteran service officers. So I've actually done that in the past here quite recently, and the county veteran service officer that I've contacted is actually got a lot on his plate right now, because not only is he covering Madison, but he's also covering Toma as well. So he's quite busy and got a lot on his plate. And the best he was able to do for me was hand me the paperwork to get started and say, well, good luck, which, I mean, is kind of not the greatest, but, I mean, at the same time, it's like, well, I mean, it's better than nothing. And I guess my question here is, with the PACT Act and you guys encouraging everybody to, like, sign up for this and contact the CVSOs and everything, are you guys going to be, like, hiring more CVSOs to kind of cover down on the influx of people coming in, like basically like covering the supply for the demand sort of thing, you know? I guess.
Oh, well, thank you so much for your question, and I'm sorry that you're experiencing that. Obviously, the PACT Act, like we said, is the largest expansion of VA benefits in VA history, and you can imagine that does stress resources to the extreme. I know that on the VHA healthcare side, we're expanding many aspects in order to accommodate the needs of the PACT Act. I can't speak for the VBA side of the house, but I know that they're probably reinforcing the best they can as well to do that. Keep in mind that the local CVSO is not the only people that can assist you in this process, although they are a great resource. You can contact your peer support. They can help you find a CVSO or other assistance. There are vet service organizations that also help, and they actually are trained by the VBA to assist with that. And you can do a lot of this online, too, to get the process started. So I'm sorry you experienced that, but realizing this is a huge expansion, I hope you can appreciate that.
Another thing that we'll do, and I want to thank you, this is John, the director, I want to thank you for bringing that up. We will get a hold of Dan's office, who runs the Dane County, if you're talking about the Dane County CVSO's office, and let them know that, we're getting these kind of comments, and see if they are intending to step up. I'm not sure. I haven't talked to them in a while, but we will pass along this comment, because we want everybody to have access to what the CVSOs have to offer, because they do a wonderful job.
Yeah, and like this is the kind of treatment that I've been getting from the CVSO for pretty much the entire time that I've lived in Wisconsin.
Okay, and are you from Dane County? Yeah, Madison. Okay.
I've been living in Madison for like a good 5-6 years. And this has pretty much been the treatment I've gotten from CVSO every time that I've gone to talk with them.
All right. Well, that's good feedback, and we certainly will pass that along to the office.
If you have any questions, you can always reach out to peer support about getting in contact with CVSOs, VSOs, or even your service organizations that can help you do that. We have a wealth of information that we're able to get on to our veterans that will help them find this information a lot easier.
Thank you, John and Ann. Next up, we have Cynthia. Cynthia Page, what question do you have for us?
Yes, hi, thank you. I have a question regarding the registry exam. What is it and how do you get on it?
Sure. Hey, this is Dr. Marsh. So there are, I believe, 6 registry exams that are available to veterans. There's different eligibility, and there's a contact person at our facility, or you can go online to the VA Exposures website and get that information as well. But we can post that.
So who is your contact person locally?
I can provide that for you. Our eligibility office does have a representative within our office. You can reach them at 608-280-7004, and they can assist you with providing you with all of this information.
Thank you, Pamela. So next up we have Tracy Urban from Milwaukee. What question do you have for us today? Tracy, are you there?
Oh, I'm sorry. I was on mute. Earlier in the discussion, there was talk about telling your war story or your story, which is wonderful and great to fully understand the veteran. However, the concern I have is that every time I'm telling my story, it's getting me physically sick. You know, the panic attacks are coming on, the headaches are coming on, I'm disorientated for a day or two. And is there ways to not tell your story so much because it's making me sick every time I'm telling each different provider this?
Hi, Tracy. This is Sarah Birdsell, mental health social worker. So previously mentioned, we at Madison VA has been very proactive with putting together a trauma-informed care work group where we are really looking at the needs of the veterans right now. So we're really taking this into account and considering how we can come up with a trauma-informed care plan that can be a part of each veteran's chart if necessary. Based on your permission as the veteran and as part of your care team. We do have a patient advocate that does specifically talk to women veterans, and specifically you can reach out to your primary care team and ask for a referral to our mental health clinic. And certainly all of the mental health care providers and all providers here at Madison VA care about reducing the re-traumatization of you within your appointments here at our facility. So I would highly encourage you to be proactive for yourself and just reach out to your provider, and we can definitely sit with you and figure something out so that your appointments are more successful for you. Thank you.
Okay, thank you.
Thank you, Sarah. Next up we have Tricia. Tricia, are you there? Tricia Newhour.
Yes, I'm here.
Oh, excellent. What is your question for us today?
Mine is a two-part question, which the first part probably isn't going to make a difference. It's in regards to the new women's clinic that's supposedly going to be built or is in the process of coming to fruition. For women that live outside of the Madison area, you're going to put us further away from the hospital. Why not have a true women's clinic at the Madison VA instead of having us go further? And the second part to the question is, will the women's clinic providers be women or a mix? Will it truly be a women's clinic? Because a lot of us suffer from trauma related to men and don't want male providers. So there is your re-traumatization, and that is an issue with the trauma-informed care as well. So how do we solve that issue?
Thank you, Tricia. So yes, we actually are not having a women's clinic. It's actually PAC teams that are women's health designated. So the providers are trained on women's health and can provide nearly all the women's health needs. Now, East Clinic is going to have a women's health designated PAC team, so that'll be all women, but there are also other PAC teams there that take both men and women that are also trained in women's care. Also on the west side of Madison, so at the West Clinic, we'll have PAC teams there, and then not just in the Madison area, but every single CBOC does have a minimum of one designated women's health PAC team. Most of them have two designated women's health PAC teams, and they are able to provide those services. And so that does open it up to more female providers as well. And so we do have Karen Hanna's PAC team. She will be going to West Clinic, and she's all women, and she's a women's health provider. And then we hope to have more offered at the East Clinic as well. And there will be women's health, women providers that are designated for women's health care at the East Clinic as well.
Okay.
Oops, sorry.
I'm sorry.
We accidentally. Sorry about that, Tracy. Feel free to leave a message after if you have some more questions, and we can follow up. We accidentally cut you off, so sorry about that. Next up, we do have Mary Hollefeld. Mary, what question do you have for us today? Oh, sorry.
Hi.
Hi, Mary.
Hi. Well, my question is pretty much, I use the Toma Whole Health Department, and they don't pay anymore for our healing touch or our whole health coaches anymore, and I want to know why they won't change it back anymore for travel pay.
Hi, Mary. This is Liana. I'm the Patient Administration Services Chief
In regards of the travel eligibility, we reimburse travel. It's based on if you're eligible for travel pay or not. I will give you the phone number for the Toma Travel Department, so you can clarify that with them. I don't know what rules they're enforcing them or what providers are you seeing specifically. So if you're ready to write down the number, it is 888-969-8048. 888-969-8048. Thank you, Yana. Look, we're looking for one more question we have. Next up, we have Jessica. Looks like Jessica from Rockford. Jessica, are you there?
Hi.
Hi, Jessica. What question do you have for us today? Good.
Okay. Well, I have two questions because I thought of another question as people are speaking, but my very first priority would have to be community care. And like you said, I am coming from Rockford, so I use the outpatient clinic, and I have to use the community care program. When are y'all going to hire some people to work there? Because I'm not talking like days or weeks. I'm talking like months that I cannot get a hold of somebody at community care to help me. And by that time, my ailment has gotten more severe, or I just can't even remember why I wanted to call community care in the first place.
Jessica, I can take that. First, I want to make it clear that our efforts to hire people aren't because we're not aggressively trying everything we can to bring people into those positions. That has been a very, very difficult department to fill, and we've pursued a lot of different promotional efforts to try to get people on board. One thing I can say is if you do know anybody that's interested in working for the VA, for anyone on the call that is interested in helping to support our community care department, we would certainly take those referrals because we love to hire veterans and we definitely have a need for managing that. I know also we have had difficulties getting phone calls answered on time, and I think Cheryl has something that she wants to add for that.
Hi, Jessica. I'm the patient advocate here, and I just want to, if you can jot down my number. I don't see your last name, so my phone number is 608-280-7182. We understand it's very difficult for patients, and if you reach out to us, we usually can help in some capacity to try to get your community care talking to the provider.
Can you say the number again?
Can you repeat your number?
Oh, I'm sorry. My phone number is 608-280-7182. That's for Cheryl. Okay.
Yeah, and I just want to reiterate, we are really actively trying to solve that staffing problem, but it has been a difficult one in this hiring.
And you know what the funny thing is?
Not answering your calls.
I say, well, I'll go work for community care and I'll start getting stuff straightened out. There we go. That is so funny that you said that. I'll have to look into that more instead of it just being like a half-hearted joke. I think I might start looking into that. The patient advocate number again is 280-7182.
And what's your other question you had? You had said you had two questions?
Sure, but I just want to clarify the patient advocate number is 280-7182.
Yes, ma'am.
That's perfect.
And then who do I speak with?
Cheryl? My name is Cheryl Scott. I'm one of the patient advocates here at the Madison Hospital.
Cheryl Scott. Okay. And now my second question is, I understand, believe me, I get it. I watch the news. I know everything about it, but we do have a opioid epidemic. However, what about the people who truly need pain medication? And the primary doctor just flat out says, I am not, giving out any narcotics whatsoever. For example, in my I'm waiting on a knee replacement. My knee is at a pain level of 9 or a 10 every single day. I go to my primary doctor and she flat out says, no, I'm not prescribing any narcotics, but that's the only thing that will work as a Band-Aid until I get my knee replacement.
So this is Dr. Marsh. I'm sorry, I'm really sorry you're having that. I know how frustrating that can be. You know, there is a pain clinic that is a possible resource for your primary care provider. And quite frankly, there are a lot of different pain medications to use. And so I think it's really kind of a discussion you're going to have with that provider about your concerns and about whether there are other options or what you guys might agree to. So again, I feel like that is certainly something that you would want to bring up with them again.
Okay, next up we have Joanne from Rockford. Joanne, do you have a question for us today?
Yes, I was just going to reiterate, somebody else called and said they were having trouble with contacting with the VSO. They're overwhelmed or something, and I'm wondering if it's the same issue in Rockford, if anybody's aware of it. I put in an email. It's been at least a month, probably more closer to 2 months, and we had no response from the VSO to set up an appointment or get in contact with them. And is there somebody over them that should be checking up that these people are doing their job, or who else can we reach out to? I mean, I understand I can reach out to the DAB and stuff like that, but I want to know why the VSO isn't responding to people.
Hi, Joanne. This is Ann, the Women's Peer. I am actually down in Rockford on Tuesdays, and I know Matt from the McChesney Park VSO office is there on Tuesdays. I also know that they are as overwhelmed as the CVSOs up in Wisconsin, with everybody trying to get in with more information and to update their claims with the expanded PACT Act. There is another CVSO in Stevenson County that you might be able to attempt to reach out to. She's always willing to help, and it is a female VSO over in Stevenson County.
Okay. Do you have like a number for her, or because we are actually right on the border of Winnebago and Stevenson County?
I do not on me at this time, but if you would like to call me, you can reach me at 608-509-1431. Again, my number is 608-509-1431. And you can reach out to me and leave a voicemail, or you could text me. I will respond to text messages.
Okay. All right. I appreciate that number then. Thank you very much.
You're welcome.
Thank you, Joanne. Next up we have Brenda. Brenda, what question do you have for us?
Hey everyone, I just wanted to give a comment. I'm a toxic exposed vet from post 9/11, and I want to encourage anyone who's going to do the PACT Act to do an intent to file, and they can do that on the va.gov website. So regardless if you're having problem with your county veteran service officer, they can backdate your claim from when you did an intent to file, and then you have to file your claim within 364 days. And I did a claim through the va.gov website all by myself without a county veteran service officer. And I think if you're computer savvy, it's okay to do it on your own and just trust the VA process. Don't get discouraged.
Thank you so much for sharing that with us, Brenda. That is wonderful information to share.
Very helpful. Thank you. Thank you, Brenda. The last call that we're able to take today is from Jan. Jan from Coloma. Are you there? Hi, Jan. What's your question for us today?
I am here.
Oh, hi. What question do you have for us? Are you there, Jan? Jean?
I am. Can you hear me?
Yes.
Okay, there we are. I am a Camp Lejeune Marine, and after I left service, I developed cancer.
cervical cancer and had to have a total hysterectomy by the time I was 30 years old. I, along with some of the other ladies that I've been listening to here, I've been having trouble with the county vet service office. I've been wanting to get in for the toxic screening. We've filed the intent to file, and I just kind of keep getting the runaround. It's almost like they really don't want to deal with female reproductive issues and that type of thing. I know everyone has a boss. Who else can I go to try and get my claim in?
Okay, thank you so much for your question. So you said that you have the presumed conditions that are associated with Camp Lejeune, and yes, you're not having any assistance with getting benefits associated with those symptoms through your vet service office?
That's correct. Matter of fact, the last time I talked to him in it was early December. I talked to the office, and the gentleman that I'd been speaking to, I was told he stepped out for a minute and he'd call me right back, and that was well over a month ago. So he must have taken a really long walk. And today, today when I called, his excuse was, "Oh, I was just looking at your file." Well, he's told me that before. I need some other resources.
Okay. You were going to look at this?
There is a toxic exposure screening that you can find online through va.gov. I don't have the full address on me at this moment. I was just trying to find it. But it is possible to go online and fill out that screening yourself, because I did it. And it took me all of about 10 minutes maybe to do it.
Do you want to provide your phone number again for her to connect with you?
So again, my phone number, this is Ann, the Women's Health Peer, and it is 608-509-1431. Again, that is 608-509-1431. And as I stated before, I will respond to text messages.
All right, excellent.
Thank you. So next we have one last question for all of you. So the question is, do you have access to Facebook? For yes, and I have liked the Madison VA page, press 1. For yes, but I have not liked the Madison VA page, press 2. For no, I do not have access to Facebook, press 3. Again, that question is, do you have access to Facebook? For yes, and I have liked the Madison VA page, press 1. For yes, but I have not liked the Madison VA page, press 2. For no, I do not have access to Facebook, press 3. Looks like most of you, well, it's about 40% that have not liked the Madison VA page. About 30% have liked the Madison page, and then about 32% do not have Facebook. All right, so we have one last update on emergency contraception from Rachel Mays, one of our clinical pharmacy specialists.
The Madison VA is committed to ensuring our women veterans have access to emergency contraception. Emergency contraception is a method of birth control that can be used following intercourse without using birth control, or if a birth control method did not work correctly. There are two types of emergency contraception that are available through the VA, Plan B and Ella. While commonly referred to as the morning after pill, there's no need to wait until the morning after to use it. In fact, it's recommended to use emergency contraception as soon as possible following unprotected intercourse. Plan B can be used for up to 72 hours following unprotected intercourse, while Ella can be used up to 120 hours later. Just as there's no reason to wait until the morning after to use emergency contraception, there's no need to wait until you need emergency contraception to request it. Primary care providers are able to prescribe emergency contraception in advance of needing to use it for veterans to have at home or to have on your medication profile. If you are interested in having emergency contraception on hand, please consider discussing this advanced prescribing with your provider. Emergency contraception can be used if you are using regular birth control, though it is not intended to be used in place of regular birth control.
If you are interested in further discussing routine birth control options, please consider reaching out to your primary care provider or primary care pharmacist.
Thank you, Rachel. That's all the time we have for questions today. If we didn't get to your question, please stay on the line, because in just a moment you'll have the chance to leave a voicemail with your questions, comments, or feedback. Please know we have recorded all questions and will make sure that everyone who raised a question and has not received a response or needs follow-up will receive a response. We plan to get back to you with a response within the next several weeks. Thank you for joining our Teletown Hall. Have a great evening.